everyone, welcome to the Health Literacy webinar series. My name is Heather and I'm from the Health Promotion team. Presenting with me today is Ange, who is also from the Health Promotion team. We have created some short videos highlighting the best bits from our recent health literacy training webinars. In this session, we are going to talk about organisational responsibility, staff responsibility, making assumptions about individual health literacy, and the universal precautions approach. Improving health literacy is a two-part responsibility. The organisation is responsible for improving health literacy through their policies, processes and systems, information, practices and people. Access Health and Community is committed to becoming a health literate organisation that makes it easier for our community to navigate, understand and use health information and services to take care of their health and well-being. So far, we have audited and updated relevant plans, policies and procedures with health literacy principles. We've produced guidelines, developed the My Health Pad, provided training for all staff, and produced a 4-year implementation plan. I'm now going to hand over to Ange, who will talk about the role of staff.
Thanks, Heather. So now we're going to look at what all of this means for you as clinicians. And I think this infographic touches nicely on some of the key ways we can help clients to understand their own health better. And I'm sure you probably already do many of these things in your practice, and some of them sound really obvious, like knowing your patients, listening, ensuring understanding. So we won't talk so much about why these things are important, but we'd just like to revisit some of these concepts and look at how our communication strategies can ensure that we're doing this in our practice. And sometimes, although we might know these things, it's good to reflect and think, is this something that I'm consistently doing, or are there better ways that I can be doing this? So, for example, on the top right-hand side of the graphic where it talks about considering how you present information, this was something which came up recently for Heather and I when we were explaining to someone the concept of unconscious bias. And this can be quite a tricky concept to unpack. So I explained it in my way, and then Heather explained it in her way, but the meaning still wasn't clear to this particular audience. So it gave us a really good opportunity to reflect on that and go back and workshop other ways that we could unpack it to ensure that the way that we're communicating is in a clear way and that's easily understandable by the audience. Although there are particular groups of people that are more affected by health literacy, we can't actually make any assumptions about this. So I think this quote sums it up really nicely. They have no visible signs of literacy disability. You cannot identify them by appearance or casual conversation. They may be poor or affluent, native born or immigrant, and are found everywhere. Healthcare providers treat them by the tens of thousands. So this quote highlights that individual health literacy is not something which we can make a judgment or an assumption about by the way that people present themselves to us in the clinic. So because we can't make assumptions about individual health literacy, good practice is to use the universal precautions approach. So we can't measure everyone's health literacy and then provide information pitched at all of these different levels. So instead, using the universal precautions approach works on the assumption that all clients have low health literacy. If we don't use this approach, for example, we might have a client who seems to be quite well educated, speaks English well, appears confident. We might assume that they can deal with being told complex information, or that they will be able to navigate their way through the health system quite easily. Often this assumption is correct, but it isn't always, and so it runs the risk of clients walking away without fully understanding their health condition or their treatment plan. Using the universal precautions approach recognises that for every single person there will be some barriers to understanding, and that it will be necessary to provide information and services in a simplified way for everyone. So in this way, we're taking specific actions to minimise risk when we don't know who is affected. In the next video, we will talk about how we can put this approach into practice using the guidelines and tools. Thank you for tuning in.